Good evening. My name is Sam Finney, and I'm going to be the MC tonight. And I'm a member of the Capital Campaign and the Ambassadors Program. So I'd like to thank you for coming out tonight and joining us to discuss the future of the Kincardine Hospital. So at this time, I'd like to make sure your phones are shut off or any electronic devices. I was doing this in the practice and realized I hadn't turned mine off, so I did shut it off now, so we're good. So as many of you know, Kincardine Community Healthcare Foundation, in partnership with the South Bruce Grey Hospital Centre and the Ministry of Health, has embarked on a significant fundraising campaign to redevelop the hospital. This evening, we're going to explain the process and bring you up to speed on the redevelopment timeline and explain what the project will entail and share a few personal stories about local health care and why it's so important to our community, to our families, and to our friends. We've set aside some time at the end for some question and answers, so if you'd like to refrain from asking the individuals when they're doing it, and we can do that at the end. And before we begin the program, I'd like to invite the president of the Kincardine Community Healthcare Foundation, Becky Fair, to say a few words.
Thanks, Sam, and thanks for doing MC duties this evening. And thank you to everybody for joining us this evening. The Kincardine Community Healthcare Foundation has the sole purpose of raising funds for the South Bruce Grey Health Centre in Kincardine. Our strength is our people. The foundation is made up almost entirely of volunteers, members of the community dedicated to improving healthcare for their neighbors. The South Bruce Grey Health Centre is the owner of the hospital and responsible for the management of the hospital. The foundation's sole purpose is to raise money for the hospital. All the foundation money raised stays here in Kincardine. Because of the redevelopment plans for the hospital, the foundation has created a special capital campaign committee dedicated to raising the $18 million, which is the local community must contribute to see all of these exciting improvements become reality. Our campaign co-chairs, Graham Mahood and Catherine Fermanis, are going to share more detail about the fundraising campaign. Catherine is going to talk first about why we need the redevelopment.
Okay, on the screen, this might not look familiar to anyone. This is the hospital as it was in 1908. It was originally a private home that was dedicated to the town for healthcare. And it's obviously been the subject of many additions over the years. So for more than 112 years, the hospital has been the backbone of our community. Generations of Kincardine and area residents have relied on its services. The hospital is at a crossroads. It hasn't had a major upgrade in 33 years. And in the 1980s, that's the period of the last upgrade, the main focus was on inpatient care. Back then, no one probably dreamt of the explosion of the need for other services provided by the hospital, like the emergency department, the lab, and all the medical imaging. Now we're at an exciting point in the evolution of the hospital, the opportunity to expand, to change the physical facility to accommodate modern medical equipment, but also, and as importantly, have dedicated, properly equipped spaces to support patients at their most vulnerable times, and to attract talented healthcare workers, including physicians. There's three parts to the redevelopment. First, there's a CT scanner, which is a new technology in the Kincardine Hospital. Secondly, there's the expansion itself, which is the actual change in the footprint and the layout. And thirdly, the addition of an MRI. So we're going to take a quick look at each of these three areas. The CT scanner, that's the first phase. It's complete and in operation. And if you look at the numbers, you can see how busy it is. And they do project that we'll get to 5,000 scans annually in time. The CT is an important tool for urgent and inpatient scans. Patients don't have to be transported to another facility, which sometimes requires a nurse or even a doctor to accompany them, which takes that nurse or doctor out of the hospital for a period. So why does the hospital need to be redeveloped? There's simply not enough room, so we need a bigger layout. The emergency rooms are cramped and some are doing double duty. The ventilation system doesn't meet current codes, and when they started to do additions to the hospital, every addition came with its own system. Other building services are either at end of life or in need of an upgrade. The layout today is geared towards 70 inpatient beds, which was the focus of the 1988 upgrade. But today, it's the emergency room, the lab, and the medical imaging that's important, and the current layout doesn't support those needs. The hospital today needs proper telecommunication fiber and connections so that if you and your doctor want to communicate with a specialist in another town or city, you can do that without having a drive. There'll also be a highly automated lab able to provide routine testing with a rapid turnaround. And you'll see front of house and back of house improvements such as patient registration cubicles for privacy and fixing the undersized receiving dock. So we need an improved work environment for physicians and staff. A better facility will help us with physician recruitment. And most important of all, we need a facility that will improve patient care. So these are some of the numbers driving the need for the redevelopment. These numbers are pre-COVID, so they're probably even on the conservative side. A busier hospital is just a new normal for many reasons. Population growth in our area is a driver. Medical technologies have changed over time. And every community has orphan patients that come to emerge, but we also have many seasonal visitors, and we have many, many contract and temporary workers that are here with Bruce Power during their refurbishment work. In fact, we have one of the busier ERs in the province. So the third part of the capital campaign or capital projects is the MRI. And today, if you need an MRI, or anyone you know, there's probably 3 things you can count on. It's likely going to be a long distance from home. It's probably going to be a long time before you can get an appointment. And your appointment could be at 2 or 3 in the morning. And there's no stats on this whatsoever, but we think it's probably going to be in the middle of the winter as well. Today, there's no MRIs between Owen Sound down to Stratford or from Lake Huron over to Highway 400. So there's definitely a need for the MRIs. In December of 2022, the province announced rural MRIs, and Kincardine was on the award list. Awarding us with a MRI means that the province will provide about $800,000 a year of operating funds, with most of that going to staffing costs. There's no provincial funds granted for the machine itself or the building that it will be housed in. So the good news is there's an MRI added to the project that was already underway, and the reality is that there's a significant cost associated with that. So really, that's enough about why we need the projects. And even though the next speaker is going to go into more detail, I thought you'd just give you an overview. So the white is the existing north end of the hospital. That's not part of the current redevelopment. The gray area is the existing area that's going to be redeveloped. Green looks at the expansion area, and on that you can see how big that green area is to give you an idea of how big the expansion will be. And blue in the middle, that's the CT scanner addition that's operating, and that'll be left as is during the redevelopment. That little blue area is 2,400 square feet, just for an idea of how big the expansion will be. And then this drawing predates the MRI announcement, so there'll be drawings in the future that include that, and I'm not sure that this is a good stat, so Drew and Stephanie might have to nod or not. We think it's around 1,600 square feet, maybe, for the addition of the MRI. Oh, a little higher, so. So overall, this is, the space will be about 2.5 times bigger, those areas, than they are today. And this is just a quick breakdown of where the expansions will occur. So that's kind of the why we need it. And now we're going to turn it over to Sam to address the next speakers. Thank you.
Thank you, Catherine. As Catherine said, our next speakers will go into more detail about the development. But first, we wanted to share a personal message from Jim Pennington. He's a Bruce Beach resident about why the quality of local health care is important to him.